so what are you in here for? What's hurting you?
My foot.
Your foot? What happened?
I stepped and somebody fell on it and it hurts.
Okay, what sport are you playing in position?
Football, running back.
All right. Can you kind of tell me what happened, like as in what position your foot was in and what you were doing exactly?
I was running up the middle and I stepped and I got hit and somebody fell on it.
Okay, what like was
This
your
foot.
foot inward or was it outward?
It was, I was here and then the way he fell on it, I went that way.
Okay. Did you hear any pops? Any abnormal? Feel any
Yeah.
abnormal sensations like numbness, tingling, anything like that?
It popped.
Pop.
Yeah.
Okay.
And the other guy said he heard it too.
Okay. So when did this happen?
5 minutes ago.
Oh, okay. So in the last game that you guys had?
Mm-hmm.
Okay. Let's see. Now we're gonna go to the observation. By the way, have you hurt this ankle before?
Mm-hmm.
No. Scale of 1 to 10. How much pain?
It's a lot, like 8.
Okay, an 8. Can I see your other foot? We're just going to look at bilaterally both feet. I'm looking for any swelling, any discoloration, just anything that would indicate like either a fracture or a really bad ankle sprain. It's on the medial side. So as we're looking at both feet, yes, we do see a abundant amount of swelling on this side. There's no discoloration yet. It just happened like 5 minutes ago. So we're going to start palpating. I'm going to start up here. If I squeeze up here, does it hurt?
Mm-hmm.
No? Okay. So once I come down the 2 bones, does it hurt in the middle?
No.
Not much pain. Okay. And then if I come around on the medial malleolus, does it hurt?
That hurts.
It hurts down here. How about right below it?
Mm-hmm.
Yes, it does hurt. On the lateral side, is there any pain when I put some pressure?
Not as much.
Not as much, just a little bit. And around this bone. On the front part of your foot, is there any pain? On the phalanges, any pain? So everything here is good, right? All right. If I bump right here, there's some pain?
A little bit.
A little bit of pain. All right. Good still? Okay.
Still a little bit, but
Just a little bit of pain. Where's the pain mainly?
right in here.
It's okay, so it's right and just skips the bone. Okay, so because I did the bump test and the squeeze test, we can rule out a fracture just because the pain is not, even though he has pain, it's not directly on the bone. So we can rule out stress fractures, complete fractures, anything like that. Now we're going to do some range of motion just to see what his range of motion, his true range of motion is, and if he has enough strength and stability. Okay, so can you please bring your foot up? So bring your toes up to your chest. All right, so it's kind of hard to do that, right? Okay, so can you bring your foot down? Is that better, or it still hurts?
Yeah.
Okay, so bring your foot inward like that. Keep this. All right, he can do it. It causes some pain or no?
Mm-hmm.
Okay, and bring it outward.
No,
Okay, that one hurts. Okay, go ahead and do that with your other foot, and I want to see. Go ahead, bring it up, bring it down, inward and outward. Okay, so good range of motion there. Here, he might be a little bit restricted because he is swollen. So now I'm going to do the same motion with you. Bear with me. It's going to hurt just a little bit, but the good thing is we know you don't have a fracture. Okay? So going up, yep, hurts. Going down, yep, okay. Going inward and going outward. So which one hurts, would you say hurts the most? Going up and out? Because that's, your face was telling me.
Yeah, probably out.
Okay, going out hurts the most. Okay, so I'm going to put some resistance right here. You're going to pull up, okay? Ready? Go ahead.
No, that hurts.
Nope, you can't do it at all. Okay, push down. Okay, you give me a little bit, but pulling up, waist back. Okay, inward. All right, a little bit. Out.
Oh.
Nope. Okay, let's do the other foot. Okay, ready? Go ahead. Good. Down. Good. Good. Okay, so right here we see a significant strength deficit in his left ankle. Very significant. So we're worried about his ligaments and not so much the bone, just the ligaments that we're worried about. So we're going to run a few special tests just to rule in certain injuries and rule out certain injuries. So what I'm concerned about here is a high ankle sprain. Not so much the lateral ankle sprain, even though he has some pain. The mechanism of injury is telling me that he has an inversion ankle sprain, so medial pain. So first, let's do the anterior drawer test. I'm gonna put my hand on the back of his calcaneus. We're gonna put him a little bit like in dorsiflexion, kind of neutral, and then we're gonna put our hand right here, and we're gonna pull upward. Yes, that hurts. Okay, that's testing for the AT-FL. He does have a little bit pain there, but then we're going to do also the inversion stress test, which will be us putting stress on the lateral side of his ankle, or the ligaments on the lateral side. So AT-FL, CFL, that's what we're testing right now. And basically, it's going to be the same thing, except we're going to invert his foot. Instead of just pulling straight up, we're going to kind of push up and invert. Some pain?
It hurts something in there.
Okay, just a little bit on the inside where it hurts. We were testing the outside, so that would be a negative test for lateral pain. Okay, and so now we're also going to check the inside, or posterior. So basically, you're gonna switch your hands. Hold on. Oh yeah. Okay, so we're gonna put our hands right here. Put them up just a little bit, and we're gonna push downward, checking posterior instead of pulling upward. Did that give you any pain?
Mm-hmm.
Just a little bit. Where?
Still right there.
Okay, still on the medial side. And now we're going to do the opposite. We're going to do eversion, the eversion stress test, which will put some stress on his deltoid ligaments on the medial side. And we're also going to add in the Kleigers on that, which will test his syndesmosis ligament, basically the ligament between the distal tib and fib bone. So first, we're going to dorsiflex, and then evert the foot. That causes a lot of pain.
It's a little bit. Yeah.
All right, and we're also looking for laxity, of course. So let me do the other side of your foot for that. Dorsiflex and evert the foot. So this side is stable. This side, he's a little stiff, but I can feel some laxity in it. So that would be a positive. And then now we're gonna put him in, to test for high ankle sprains, we're gonna put him in dorsiflexion, which hurts a lot.
Mm-hmm.
And then we're gonna externally rotate the foot, which hurts because he's in dorsiflexion. But do you feel any pain on the top? So we're gonna rule out high ankle sprains, and then now we're gonna put him in kind of a neutral position, because we're gonna test the deltoid ligaments, and then we're gonna also externally rotate the foot. So that's more pain because we're stressing the deltoid ligaments. So because of the test being positive for the deltoid ligaments, and because of the amount of swelling, and he soon will probably get some bruising, I think that it is my diagnosis is an eversion ankle sprain. We were able to rule out the fracture. We were able to rule out high ankle sprains, and because most of his pain is on the medial side and not the lateral side, we were able to rule out a lateral ankle sprains. So for treatment, because of the amount of swelling, he is not going to be able to go back in. It is probably a grade 2 ankle sprain right now, and he did hear the pop, so it's a grade 2 or higher. We are going to start with icing first, get as much swelling down. Since it's acute, we're just going to ice today, maybe give him some NSAIDs. We want our main focus to be controlling the pain and getting his range of motion back, which would mean reducing the edema. So some treatments, we could use manual therapy, milk massage, anything that is going to activate his lymphatic system, open up those nodes. And then after that, we're gonna do some strengthening. So 4-way ankle, we're gonna work on balancing, so 30 seconds balance on the AirX pad and also RDLs. And we're just gonna work on his proprioception as well. Once we get him back to like 80% function, then we can start talking about taping, preventative measures so he can get back on the field. Okay, so I'll talk to your coach.